Welcome to today's episode of Talking Tinnitus. We're here with special guest, Dr. Sarah Mathews. Sarah holds a doctorate of audiology from Salus University, has been seeing tinnitus patients since 2009, and is currently clinically training tinnitus experts on the linear tinnitus treatment device. So you're very welcome to the show, Sarah. It's a pleasure to have you.
Thank you. It's a pleasure to be here now.
So today we are asking, are there different types of tinnitus? So Sarah, are there different types of tinnitus?
That is a great question. And one of the early questions that patients often ask when they start down the tinnitus journey. And yes, there's multiple different types of tinnitus. The most common that we see is called subjective.
Sure.
Meaning that the person that is experiencing the tinnitus is the only one that can hear the tinnitus. And about 99% of patients with tinnitus fall into that category.
99%. Wow. So the overwhelming majority has subjective tinnitus.
You got it. Now, the other part of that is objective tinnitus, where somebody else besides the person that's experiencing it can hear the tinnitus. And that often comes from some sort of physical part of their body contributing into making that sound. So we can get like palatal myoclonase, or we can get tensor tympani syndrome, some things that are creating situations where the body's moving and creating a sound with that movement.
Yeah. Okay. Interesting. So would there be, I suppose, different clinical pathways for subjective and objective tinnitus? How should we think about that? How should people who are kind of, maybe they've just started experiencing it, they don't really know what's happening. How should they think about that?
Yeah, absolutely there is. Because if you think about the fact that there is something physical creating the objective tinnitus,
Sure.
Then there should be something that we can physically do to address that.
Great. Yeah.
So we need to go down the path of getting a proper medical diagnosis, proper medical treatment for whatever is contributing and creating that situation.
That could be like an MRI, that could be surgery, could be a variety of things for this specific kind of cause.
Yep, yeah. You got it. They may eventually come back and join into the subjective group in terms of we still need to work on how do we deal with the end result after medical treatment has been applied. But that is absolutely the first pathway that they need to go to. Sure. Whereas with subjective tinnitus, there isn't as much that we need to absolutely have done from a medical pathway. Okay. Still is a smart idea to see an ENT, see an audiologist, have the diagnostics done, but there likely isn't going to be this medical pathway to treatment for those patients.
Understood.
And it's more about what are the strategies to create an individualized treatment plan using sound therapy, linear, using amplification, cognitive behavioral therapy, mindfulness, all those tools that get added into an individualized treatment program.
Makes sense. Super. And so I think it might be an important point of distinction is that people, when they first have tinnitus and first start experiencing it, they might experience it in different ways. It might manifest differently for different people. So like whooshing, hissing, crackling, or famously called ringing in the ears, right? Even though maybe not everybody experiences it as ringing, but I think within it being subjective or objective, people can also perceive the sound in different ways. I think it's an important distinction that the ringing tinnitus mightn't be different than the whooshing tinnitus. It's subjective and objective, and you might experience the sounds differently.
Yeah, and I think even within that category of subjective, when we look at that category, we know that there are things like pulsatile tinnitus, where it's pulsing in the same rhythm as the heartbeat.
Yeah.
Okay, that's a very different sound than a ringing in the ear, and that's a very different cause potentially as well. We may even get with somatic patients where their tinnitus shifts and changes in pitch, loudness, location, or even the type of sound that they hear when they move their shoulders, neck, jaw, head. So absolutely what they experience and how they describe it, what it sounds like, where it's located can all shift and change based off some of those components of what type of tinnitus do I really have.
Okay.
And that can help in terms of a provider being able to narrow in on really qualifying and quantifying what is the full picture of what you're experiencing.
Yeah.
And what components do we need to include in your treatment process.
Interesting. We just had a great discussion on the show earlier, actually, with Dr. Gail Brenner, who gave us a deep dive into pulsatile tinnitus. But I think that probably the key message to take away is that regardless of kind of how you're experiencing it and the specificity to you, a certified tinnitus expert, an audiologist who specializes in seeing tinnitus patients is the best person to go to kind of have that conversation and figure out exactly kind of what's happening, why you're experiencing it the way you are experiencing it, and then maybe figure out the best pathway to ultimately manage it.
Absolutely. That'll put you down the pathway of, do we need some medical treatment? Do we need some audiological treatments? Do we need to be worried that it shifts and changes at this point in the day, or when I move my head, or when I'm in this environment? They can give you more guidance in terms of, yep, that's normal, or maybe that's not normal, and we need to, investigate that a little bit more and take that into account.
Super. Well, thank you very much, Sarah. So there definitely are different types of tinnitus. We've got subjective and objective, and then within those, there's even subtypes within that. And so go and talk to a tinnitus expert to figure out, and they'll guide you on the best path.
Absolutely.
Super. Thank you very much.